Hi, I'm Philip Manger. I'm an ear, nose, and throat surgeon at Advanced Specialty Associates. I got my medical training in Boston at Boston University School of Medicine, and I finished there in the year 2000. And then I went from there to Yale University, where I did general surgery and my ear, nose, and throat residency. And so I finished that in 2005. And following that, I moved out to the Midwest, which is where my wife and I always wanted to settle. Although I was raised in Connecticut, so we moved nearer to where my wife grew up. Recently, I joined Dr. Waters up here, and I've been very happy with the transition. And I've been practicing since 2005. I think the thing that got me most interested in ear, nose, and throat was two experiences I had. One was just the sense that it was the last bastion of true medicine, where you could take care of your patients, and then if they needed surgery, you would manage them medically as long as you could, and then take them for surgery if they needed it. But the other impactful experience I had was that it was so impressive to me seeing young children, especially, who were struggling and having trouble with their hearing and recurrent ear infections, have a minimally invasive procedure and then transition towards a happy, healthy childhood, whereas they had been in and out of doctors' offices and on and off oral antibiotics most of their lives leading up to that. That always left a big impression on me, and actually has been one of the more fulfilling parts of the career. The other thing that I really enjoy about ear, nose, and throat is that many of the surgeries are more minimally invasive that I provide care with, and so it allows me to take someone from feeling like they have a daily headache, or they have daily nasal congestion, or poor sleep, or some discomfort in their life, and without subjecting them to tremendous risk, help them feel a more normal experience and a more healthy daily life. The other thing I would just bring up to you is that, if you ever have questions about your care, or something about a diagnosis you've been given doesn't make any sense, I invite you to ask me all about that, because I say this often, but it's true. I mean, we're all patients, and so I want you to think of me as a resource, but I'm not only a doctor, I've been a patient myself, and I haven't always gotten the best care, so I try to do better for my patients than I have gotten myself, and I hope I can do that for you. In terms of outside interests and hobbies, I played competitive tennis growing up, and although during my medical training I didn't get to play very much tennis, I've gotten back into that again, and it's been very fulfilling. And I enjoy collecting records, which is, I realize, a dying hobby. But those are the things that I enjoy doing, besides spending time with my family, which is my first priority.